Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we're going to focus on the primary forms of the vasculitis with the sites of the involvement. So first, beginning with the aorta in case of the giant cell arthritis. So the factors we are considering are the aorta, medium-sized arteries, small-sized arteries, and the capillaries and veins. So giant cell arteries, it is associated with the aorta as well as the middle-sized arteries. Next is the granulomatosis with polyangiitis, or we can call it the Wegener's granulomatosis. So this is it is positive for the medium-sized, small-sized, as well as the medium-sized, small-sized, as well as the capillaries. Next is the Churg-Strauss syndrome. Churg-Strauss syndrome will be positive for the medium-sized, the small-sized, as well as the capillaries. It may or may not be present. Then moving on to the PAN. Here it is again the same, that is the medium-sized, small-sized, and the capillaries. No, it is the medium-sized and the small-sized. The capillaries remain negative as well as the veins. Then moving on to the leukocytosis, leukocytoclastic vasculitis. So here it is positive for the small size capillary and the veins. And looking at the Buerger's disease, it is positive for the medium size, small size, as well as the veins. Then comes the Behçet's disease. The Behçet's disease, it is associated with the positive for all. That is only the aorta, it remains negative. Aorta remains negative, whereas all the others, the medium size, small size, veins and capillaries, it becomes positive. To learn and grow daily like this, please do subscribe.